Good morning. Good morning. Welcome to the Medicare presentation being hosted by AAA. We're going to give everyone a minute or so to log in. You'll hear me keep talking every time I see someone log in. I'm going to welcome them just to make sure they can hear me so we can get all the audio situated before we go in. We'll probably start the presentation about maybe 10:02, 10:03, so we're going to just give everyone a minute. We're only at about half our expected attendees list at this point, so I thank you for being early and being on time, but we all know technical situations sometimes take a minute to sign up, so we are going to give everyone just a minute more. We'll start the presentation at 10:02, 10:03. Welcome. Good morning and welcome. Just saying hi to all our newly signed on. We're giving everyone just a minute to log in. We'll start at 10:02 to 10:03. Thank you for being on time and thank you those who were early. We'll give everyone just another minute or two here to get in. We are slowly creeping up there in attendee numbers. Welcome. We're holding pretty steady at our attendees list, so we're going to give them just a couple more seconds to get in, and then we'll get going on this lovely sunny Friday. I at least hope it's sunny for all of you. I'm out in Syracuse, and for once I can actually see blue skies, so I hope everyone across our territories also had a little bit of sun in their life today. Welcome, welcome. We're giving everyone just a minute or two more to come on in and make sure their audio's working. All right, guys. Well, thank you for your patience. And again, thank you for being on time to our presentation. My name is Sarah Wallace. Again, I'm in the Syracuse area. I also have Elizabeth Sharia here with me from Buffalo. She's going to help out with a lot of the ins and outs later in the presentation. So we are your two Medicare agents. We'll be able to answer all your questions and kind of get you started on your Medicare path. So we are going to help you solve your own Medicare puzzle. But first, where does AAA fit into all this, right? So we're here to kind of educate you and help you avoid the pitfalls and obstacles that come along with Medicare, what to do when. We have a dedicated phone number for you to call. You can call us right at our desks when you have any questions. All of our calls are recorded for accuracy. So if you have any questions and you're not sure, we can always go back and listen to that. And in this age of limited interaction. We also do have video conferencing. So if you would like to be face to face with your agent, although over the computer, we can absolutely accommodate you for that. Digital forms are available for signature. So that's a new thing with Medicare. Everything used to be in paper and face to face, but with the changes that 2020 brought, we can now do everything digitally and over the phone to keep you guys safe. And all documentation will be emailed immediately after each appointment. So we're really here to help educate you, get you on the right path. And then if you decide one of these plans is right for you, we'd be able to help sign you up for that. So what are those common Medicare potholes that we're talking about? And these are important. They'll come up throughout the rest of the slides, but here's where people really get stuck on their Medicare journey. You know, what are your enrollment periods? What do you need to sign up for when? You know, how do you avoid Part B penalties? Are the physicians networks going to be covered under these plans? Do you have a doctor, a primary care physician that you really don't want to part from? We want to make sure that they're going to be covered under any plan, you know, that you are considering. Another big thing, another big pothole is those drug formularies and how much your prescriptions are going to cost with each of the carriers. You know, can we save you some money with one carrier over the other? What are your drugs going to cost? And we can help you identify that. And then one of the biggest choices to make as a Medicare enrollee is whether or not to use a Medicare Advantage or a Medicare supplement plan, and really what is the difference between the two. So in an hour, we're going to try to bring some clarity to all of these potholes. If you have any questions throughout the presentation, I want to bring your attention to the questions feature of GoToMeeting. You can send it privately to staff or you can send it to all. If you have any questions along the way, we will get those answered for you. Some questions we won't be able to answer right here, right now, mostly for the protection of your information. So if you do ask a question like that, usually that means it's a good question and you're on the right path. We'll reach out and set up a time to talk person to person. All right. With that being said, we're going to start with our first pothole, which is the enrollment periods. What can I sign up for when? When do I start thinking about Medicare? So usually we, well, not usually, before 2020, we do this in person and I could look around the room and say, who's turning 65, right? Because that's the first thing that everyone thinks about. And this is the period of time that's most relevant to you if you are turning 65 and looking to sign up for Medicare. And this is called your initial enrollment period. This is actually a 7-month period. It starts 3 months before your birth month, the month of your birth month, and 3 months afterward, where you can sign up for original Medicare. We'll go into what original Medicare means later, but that's just parts A and B. So you have that 7-month period starting at age 65. Again, it's 3 months before your birth month, the month of your birth, and 3 months afterwards. Another very important enrollment period to remember and kind of document for yourself, because this comes up every year. This is your annual enrollment period. And this is from October 15th to December 7th. This is where you can add, change, or drop any of your Medicare Advantage or Part D coverage. If the plan you used last year isn't working for your health needs this year, this is the time that you can change that, or even just consider changing it and compare plans. It's important to note that, right? Because our health journey isn't the same year over year. One year we're, you know, a little bit healthier than the next, and it goes back and forth. So you want to make sure that the plan you're currently on is going to work for your forecasted needs. Yep, and we can help you with that. The next enrollment period we're going to talk about is the open enrollment period. This one's a little less advertised. You're not going to get the flyers in the mail. You're not going to get the phone calls. This is for people who already have an existing plan where you can change your coverage. It's annually from January 1st to March 31st. So say you signed up for a plan during your annual enrollment period, the one we just talked about, and you're starting to use it and you find it doesn't cover one of your specialists. You still have this time period from January 1st to March 31st to change that plan or to look in and see if there's a plan that better suits your needs. So while this is unadvertised, it's very useful as a Medicare enrollee in case your health changes and you've got to change that plan you're currently on. All right, and we'll roll right into the last enrollment period, and those are special enrollment periods. These are triggered by specific events, such as moving out of a network coverage area. So if you move from New York to Florida, that's going to trigger a special enrollment period if you're already eligible for Medicare. Another special enrollment period that's very important is retirement, right? So maybe you worked after 65 and retirement is coming up. That is going to also trigger a special enrollment period where you can change your coverage and make sure that you're covered, as you retire. Because no one wants to worry about their health care once they're retired. They want to know what's going on, sign up for it, and then once retirement comes, let's sit back and relax at least for a little while. So those are the main enrollment periods, and that's why it gets a little confusing. Some of them happen annually, some of them are triggered by specific events. So being able to identify where you are and what enrollment period you're in, that's something me and Elizabeth are absolutely able to help you out with. We can identify when to sign up for it, what enrollment you're going to use, and we can help you compare those plans. So speaking of Elizabeth, I am going to hand it over to her to go over the Medicare overview. Again, if you have any questions while we're going through this, use that questions box. I will type out an answer for you. And then again, if it's something that we can't answer here, I'll let you know that, and I'll let you know why. So Elizabeth, if you would.
Thank you so much, Sarah. So as she said, my name is Elizabeth Sharia. I'm one of the Medicare agents here for AAA. Sarah kind of handles the central New York portion. Sarah is more the Syracuse area. I am more the Buffalo area, and we both handle the Rochester region. As she stated, if you look over on the right or in the toolbox, there is a question box where you can ask, you can ask us anything as we're going along if something's unclear. If you do have a question that's pretty detailed or involved or requires an extensive answer, we'll probably get back to you after the webinar is completed, just so we can try to get everybody out of here in a timely fashion. But without further ado, let's go ahead and move on. Okay, so here's the Medicare basics. This is what Medicare consists of. Medicare Part A is your hospital insurance. That is really only going to cover your room and board when you're in the hospital. It also covers inpatient or skilled nursing facility, hospice, and home health care. However, when you have Medicare Part A, you really only have coverage to be in a hospital and nothing else. Medicare Part B, which Medicare Part B is your medical insurance. That covers your doctor's services, outpatient services, preventative durable medical equipment, diagnostics, pretty much everything else that you would have with as far as your healthcare needs go, falls under Medicare Part B. Now, Medicare Part B is the portion of Medicare that has a premium attached to it monthly. Medicare Part A is what is considered an entitlement. I personally don't like calling it an entitlement, simply because you've been working your entire life and paying into the Medicare system. So you're not receiving that free of charge. You've worked for it for a long time, and now you're receiving it. Medicare Part B, however, has a monthly premium. That monthly premium is generally $148.50 this year. Most people fall under that premium. If you do make below a certain number, depending on whether, and the reason I'm not giving you that exact number is because it depends on if you're married or single, but if your income falls below a certain level, then you would be entitled to either Medicaid benefits or extra help. And if your income is above a certain level, again, depending on whether or not you're married or single, you would have to pay more for that. But generally, everybody falls, or most people fall in the middle. Now, Medicare Part D is your prescription drug coverage. And we're going to get into a lot of details about that because the prescription drug portion is pretty complicated. And for the purposes of this webinar, we're going to do just basically a high-level overview of what your prescription drugs look like in Medicare. But those three parts form together to create a Medicare Part C or a Medicare Advantage plan. Now, I'm going to get into a lot of details about what Medicare Part C is, how you get it, where you get it from. But basically, Medicare Part C is when your A, B, and D are handed over to a private carrier, and that private carrier is now managing your plan. And Letty, I see you have a question, and Barbara also has a question. So I'm going to answer Letty first. Letty's question is, I'm still working and my employer is providing health insurance. Should I continue paying that health insurance or keep? Okay, Letty, there's a couple different options for you now once you turn 65. If you're continuing to work and your employer has more than 20 employees on your plan, on the group plan, then you can postpone picking up Part B and a Medicare Advantage plan or Medigap plan. As long as you're still actively employed and actively working and covered under that group plan, you don't have to pick up Medicare Part B. The same is true if you are covered under your spouse's plan, as long as they are actively employed. And I do want to emphasize that active employment portion because whomever is holding the group insurance policy needs to be actively employed in order to not receive that penalty if you postpone Part B. And the penalty situation would come into play if you don't sign up for Part B when you need to. And okay, and I'll get into a lot more of that in just a moment. Barbara, my health insurance is through my husband's employer. Am I required to go on? Okay, so Barbara, it looks like I kind of answered the question for you. As long as your husband is actively employed and there are more than 20 employees on the group plan, you do not have to pick up Medicare at this time. And Letty, I said Medicare Part B. Part as in boy. Medicare Part D also has a penalty if you don't sign up for it. But as long as you're covered, it's considered, as long as the insurance that you have is considered credible coverage, you're free to postpone that and not have to worry about the penalty. And Daniel, 148 for Part B, is that per month? Yes, Daniel. Your 148 premium is either going to be deducted from your Social Security check if you're taking Social Security, or they will bill you quarterly. So your quarterly bill is going to come in around $500 every month, or I'm sorry, every 3 months, and you will have to pay that out of pocket. Now, let's go ahead and move on. I'm going to try to keep this going a little bit, but I'm going to get into some of the penalties here in just a moment. So this is what your red, white, and blue or your Medicare card is going to look like. A lot of people tell me, you know, oh, I have my red, white, and blue card, but then when I take a look at it, or if I, you know, when I take a look, I see only hospital Part A on there. You have to have A and B in order to have a Medicare Advantage or a Medigap plan. And I don't see any further questions, so let's go ahead and move on. Okay, so here's where I'm going to get into a little bit of the penalties and some of what you could be facing. So this is what original Medicare looks like. This is what you would have If all you had was original Medicare and you didn't pick up any type of Medicare Advantage or Medigap plan. Your Medicare Part A covers inpatient hospital, okay? And there's a deductible of $1,484 for days 1 through 60. If you're in the hospital for longer than 60 days, you're going to pay $371 per day. After day 91, you're going to pay $742 per day. And at that point, you're using your lifetime reserve days. Okay, you get 60 days for your entire life to use for in the hospital. Okay, and once those are gone, those are gone. And your skilled nursing facility, you don't pay anything for days 1 through 20. After day 21, you're going to pay $185 per day. After days 101, you're responsible for all costs. All right. So original Medicare Part A is not super comprehensive. I'll just put it that way. Now your Part B, like I said, is $148.50 per month for most people. Part B has a yearly deductible of $203, which isn't super high. You know, one visit to the doctor and you're pretty much at your yearly deductible. After that deductible is met, Medicare will pay 80% of your costs, leaving a 20% co-insurance to you. So what does that mean? That means regardless of how high your medical bills go, you're responsible for 20%. That 20% could be 20% of $100, which isn't going to, ruin your retirement. Or it could be 20% of $100,000 if you have a bad year, which could significantly jeopardize your retirement or, cause some issues later on down the road. Now, because of that 20% exposure, that is why most people choose either a Medicare Advantage plan or a Medigap plan. And when I mentioned the penalties, Part B has a 10% penalty for every year that you go without Part B that you were supposed to sign up. So I'm going to use Barbara and Letty as an example. Letty is still working, and she is covered under her group, her employer plan for insurance. Let's say Letty decides to work until she's 70. So she's gone 5 years without signing up for Part B when she was first eligible when she turned 65. Letty is not going to have a penalty because she had credible coverage under her employer. Like I said, because as long as her employer has more than 20 employees on it and her coverage is considered credible coverage, then she's okay. She won't have that penalty. If she did not have that coverage and Letty is now retiring, or she decides to go on to Medicare when she's 70 and she's gone 5 years without coverage, she's going to have a 10% penalty. So the penalty is 10% of the average annual premium, and it compounds every year, and you can't pay it off and you can't pay it down. So Letty will always have to pay a higher premium than other people because she went so long without insurance. Now in Barbara's situation, Barbara's covered under her husband's employer. Okay, and let's say her husband works until Barbara is 70. As long as her husband is actively employed, and again, there's more than 20 employees on that group coverage, Barbara is clear to stay on that employer plan. However, and this is a real life situation, something that actually happened to somebody that I dealt with in the past. Okay, and so this is a terrible situation, and one that I use a lot as an example simply because it is something I do not want to happen to anybody else. All right, I had a woman come in to talk to me. She was 87 years old and she had just lost her husband. And because she just lost her husband, she lost her health insurance. Her husband was a retired state trooper. Her husband retired at the age of 65. She was also 65 when her husband retired. Okay? And her husband's retirement told her she could remain on his group plan because he had a pension, which is wonderful. And there was no problem with her staying on that. However, the moment her husband retired, he was no longer an active employee, and therefore the clock started for her to pick up Part B. And she went 22 years without picking up Part B. And when she lost her husband and lost her insurance, she went down to Social Security to sign up for Medicare, and they informed her because she'd gone that long without coverage, she was going to have to pay more than $1,000 per month for her Medicare Part B, which she couldn't afford. So at that point, not only had she lost her husband, but at 87 years of age, she found out she didn't have any health insurance coverage and she couldn't afford it. So when she spoke to me, at first I was like, oh, there's absolutely no way that somebody made a mistake. We'll get you coverage. But it was the only circumstance that I've ever found myself in where I could not help somebody. And it's a terrible situation and one I never ever want to see anybody experience. So when you are looking at either working or your spouse continuing to work past the age of 65, make sure you can mentally check those boxes that your coverage is considered credible. Okay, and you can get that information from your HR or the benefits administrator. Make sure that whoever is holding the group insurance policy, whether it's yourself or your spouse, that you or your spouse has to be actively employed. And then the other box you need to mentally check is that there are more than 20 employees on that group plan. Okay, because another real life scenario, I spoke to somebody yesterday who wants to remain on their spouse's plan, but there's only 5 people on that group plan. So my answer was, yeah, you can do that, but just be aware that if you don't pick up Part B, then you are going to have that penalty. Okay, and I think I've brought a serious enough tone for this slide. So, and I don't see any more questions, so we're going to go ahead and move on. Okay, so now we're going to get into the part of how do you cover that 20% exposure? How do you cover that Part B coinsurance? And like I said, there's 2 different options. You can have a Medicare supplement or Medigap plan, or you can have Medicare Advantage or Medicare Part C, okay? Here's where I want you to make a mental note of this. Medicare supplement and Medigap are interchangeable terms for the exact same thing. And Medicare Advantage and Medicare Part C are interchangeable terms for the exact same thing. However, Medicare Supplement or Medigap and Medicare Advantage or Part C are not the same thing. They're 2 different things. Okay, so just make a mental note of that and we're going to move on. Okay, so a Medicare Supplement plan. The differences between these 2 is always somewhat difficult to explain. But a high-level overview is when you have a Medicare supplement plan, you don't have a network of doctors, okay? You can go to any doctor, any facility, anywhere in the country as long as they accept Medicare, okay? Because Medicare A and B are going to be your primary insurance. Medicare is going to pay that doctor 80%, and then your Medicare supplement or your Medigap plan is going to pay the difference. Okay, so that 20% exposure is covered by the Medicare supplement plan. And then they're guaranteed renewable as long as your premium is paid. So the premium's not going to increase. They cannot cancel the premium or they can't cancel the plan because of your health. They can't increase the premium because of your health. You will get the exact same plan year over year as long as you're paying the premium. Okay, and then the coverage and benefits never change. You're always going to have the exact same coverage. The premium will increase here and there. Most of the Medicare the Medigap plans didn't really increase last year to this year, but sometimes they do. And the plans are very comprehensive, providing minimal to no out-of-pocket healthcare related expenses, which means, depending on the plan that you choose, you might have no deductible, no co-pays, no out-of-pocket costs. As long as you're paying that premium, you'll never see another bill. So when somebody is asking me, what is a Medicare supplement plan? What's a Medigap plan? I always say the main way you can think of the difference between gap and advantage is who's paying the bill. With a Medigap plan, Medicare is paying your doctors first, and then the gap plan pays the difference. With Advantage, Medicare Advantage or Part C, your carrier is paying the doctors, and then you pay whatever co-pays you have. Okay, and I don't see any questions about that. And I'm going to assume it's because I am just super good at explaining things and not that I'm being so confusing that nobody even knows what to ask. So we're going to go ahead and move on. So Medicare Advantage or Medicare Part C. Medicare Part C plans, like I said, who is paying the bill? Who's paying your doctor? Who's paying the hospital? And with a Medicare Advantage plan, the answer is the carrier. Whatever carrier you choose, there's major carriers in this area. I'm not going to mention any, but you know what kind of carriers there are in the area. And these plans must cover all medical and hospital services that original Medicare covers, except for hospice care. Hospice and nursing home coverage will always be covered under Medicare Part A because it's considered end-of-life care. Okay, once you reach that stage and that situation, you'll have to have a different conversation. But Medicare Advantage plans have to cover everything that original Medicare covers. And 99% of the plans also include prescription drugs. Okay, that's another difference between Medigap plans that I didn't go into in the last slide that I do want to mention here is that Medicare supplement plans do not have prescription drug coverage. There's no coverage for prescription drugs when you have a GAP plan, and therefore you do have to pick up a third carrier. So when you're under a GAP plan, you're going to have Medicare, whoever your Medigap policy is, and then your prescription drug coverage. But under a Medicare Advantage plan, all of that is included in one plan. Okay, and they usually add things like vision, dental services, hearing benefits, gym memberships. It's very similar to the group plan that you have when you're working. Okay, and the reason I said 99% of the plans cover prescription drugs is because there are very specific Medicare Advantage plans that do not include prescription drugs. And those plans are designed for people who have like TRICARE or VA benefits, or their prescriptions are covered through some federal program. Okay, and the other thing about Medicare Advantage plans is they are very inexpensive. The plans start at $0 extra. And when I say 0 extra, I mean you're always going to have to pay that $148.50 to the government, and then whatever plan you choose would be over and above that. Okay, so Medicare Advantage plans start at 0, and then they go up to about $200 per month in premium depending on what you choose. However, you are going to have co-pays. You are going to have out-of-pocket costs. There is going to be some sort of responsibility to you. However, instead of a 20% co-insurance, it's nearly all of the services are a flat dollar amount. So you're looking at, just a set number rather than 20% of whatever. Okay, I don't see any additional questions, so we're going to go ahead and move on. And I promise we are going to try to get you out of here by 10:45 at the latest. So we're very nearly done. And then myself and Sarah will be available for the rest of the day for questions, calls, anything you want to reach out to us about. And we will be reaching out to you personally at some point, probably around Monday, to see if all of your questions were answered. So comparing your options. When you're looking at a Medigap plan, you have low to zero out-of-pocket expenses. You have no networks. You have the option of choosing a separate prescription drug carrier, and the benefits are never going to change. You're always going to have the same coverages. A Medicare Part C plan or Medicare Advantage plan has very low monthly premiums to no monthly premium. However, you do have copays, you do have out-of-pocket costs when you use the plan. And most plans can include prescription drug coverage. However, Medicare Advantage plans are going to be either HMO or PPO in these areas. There's a few that have different style coverages, but the plans that are going to be available to anybody on this call are going to be HMO or PPO, so you will have a network. Okay, but you do get those extra benefits like vision and dental, gym memberships, and other benefits. Okay, so when you're comparing your options, when you're thinking about what you need to do, what's going to be the best option for you, a good way to consider it is pay now or pay later, because that's pretty much what insurance is. Either you're going to pay a higher monthly premium and you're not going to have anything else, or you're not going to pay a monthly premium and you will have some out-of-pocket costs when you do use the plan. And I don't see any questions, so I'm going to go ahead and move on. Okay, so here's where we're going to get a little bit confusing. And if you have any specific prescription drug related questions, please reach out to me afterwards. This is going to be a very theoretical, high level overview because we cannot get into any details on your specific drug situation. Okay, but we can do a full analysis of what your drug costs are going to look like. If you're turning 65 this year and you want to know what your drug costs are going to look like carrier by carrier, we can do that for you. We can show you exactly what you're going to pay. Okay, so this is just going to be an overview of what you're looking at. Okay, so most of the carriers in this area, and pretty much all of them, have a 5-tier drug plan program. The drug tier is basically what you are going to pay for it. Tier 1 is your preferred generics. Tier 2 is your generic. Tier 3 is preferred brands. Tier 4 is non-preferred, and Tier 5 is specialty. Obviously, specialty medications are going to be the most expensive, and all of the carriers that I work with, they all charge a percentage for your specialty medications. Okay, some specialty medications that I have worked with people cost thousands of dollars per month, and people are responsible for paying a good portion of that. You know, they might be responsible for 25, 27, 30% of that. Your tier 1 and tier 2 is where you want your medications to be. Okay, and the good thing is that all of the carriers have to offer every therapeutic category of medication in each tier. Okay, the bad thing is that each one of the carriers pays a different retail cost for your medication because they all have different contracts with the drug manufacturers. So the price of your medication is not just the price of your medication wherever you go. And that's why your drug tiers are a big pothole that you're going to find. And that's why we mentioned it, is because your drug might be a completely different and very radical difference from carrier to carrier. Okay, so that's definitely something you want to pay attention to, and you want to know what you're going to be paying. Okay, so I don't see any questions so far, so I'm going to go ahead and move on. I'm sorry, just one second. Okay, there we go. Okay, so here is what your 2021 prescription drug costs look like. Okay, and as I stated, this is going to be kind of a high level overview, but your initial coverage phase is basically the time when you are paying your copays and you're not really worrying about anything else. However, the full retail cost of your medication is adding up until you reach $4,130. So just imagine that your drug cost has a ceiling, okay? And every single month that you're getting your prescriptions refilled, even if you're only paying, if you're paying a $12 copay because it's a tier 2 generic medication, but that medication actually costs $150, that full $150 is going towards hitting $4,130. Okay, and each one of your medications counts. So if you're on multiple medications, you're going to hit that 4130 faster. However, if you're on very, very inexpensive medications, this is probably not going to be something that concerns you. However, once you reach 4130, you're going to enter the coverage gap, or as it used to be known, the donut hole. In the coverage gap, you are going to be responsible for paying 25% of your drug costs. Okay, so that $12 copay might increase to $50 or $60 each time you get that medication refilled. Okay, and you are going to continue to pay 25% of your drug costs until your true out of pocket. So now the retail cost of your medication doesn't count, only what you're actually paying counts. And you are going to continue to pay 25% until you have paid $6,550. Once you hit $6,550, you're going to hit catastrophic coverage. And in catastrophic coverage, you will pay $3.70 for generic, or $9.20 for brand names, or 5%, whichever is greater, until the end of the calendar year. Now, one thing I have had questions about multiple times is people think that catastrophic coverage means that the medications that you're taking are essential. That's not what catastrophic coverage means. Catastrophic refers to the amount of money that you have paid for your medications. Now, this is all pretty scary if you're on a lot of different medications, which is why I always say, if medications are something that is very concerning to you, please reach out to us and we can do a full analysis of what your prescription drug costs will look like, carrier by carrier, and we can help you narrow down and find which carrier is going to offer you the best coverage for what you are specifically taking. Okay, and I don't see any questions about that, so I'm going to go ahead and move on. Okay, so thinking about the future. And here's where I'm looking at the clock and it's 10:41, so we're right on time for wrapping things up. Your health situation today is not going to be the same next year. It might not be the same the year after that. It's always going to be changing. So you always need to be proactive in choosing what kind of coverage you're going to need. And also, your situation is going to be completely unique and completely different from anybody else's. You are not going to have this, you might not have the same plan or the same carrier as your spouse because your situation is unique even to your own family members. So what I hear a lot of people say is, well, my neighbor told me that they're on this plan and this plan is the best. That might be the situation for your neighbor, but it doesn't mean it's the situation for you. So that's where we come in, and that's what we're here to do. We are here to help you figure out what plan, what carrier, what type of plan is going to fit your unique needs the best. And to do that, let me just show you our information here. I'm going to go ahead and move on because I don't see any questions. Okay, your next steps. What are your next steps going to be? Well, if you are turning 65 this year, you're going to want to start making plans, start figuring out what you're going to need to do. Are you going to be retiring or are you going to continue to work? Are you covered under a spouse's plan or are you going to leave your spouse's plan? You're going to need to figure out what steps are right for you and what situation is going to fit you, okay? And to do that, to help you figure out exactly what your Medicare journey is going to look like, this is my information. My name is Elizabeth Sharia. I'm in the Buffalo region. I do also service a portion of Rochester. That's my direct contact number. If you dial that, it is going to ring directly to my desk. And my email address is also listed there. Email is always a really good way to reach out to me because I can answer you pretty quickly. If I do a lot of appointments. I do a lot of research and work for people, so I'm on the phone quite a bit. So if you can't get through to me via my direct line, always send me an email and I will get back to you as soon as I can. Sarah's information is there also. Sarah services the Syracuse area and also a portion of Rochester. And same thing, you can reach her directly at that number, or you can reach her at her email address. And since I don't see any questions, we're going to go ahead and wrap it up for today. Thank you so much, everybody, for your time. Barbara, let me give you a call, Barbara, on that one, since we're just about out of time right now. I'll give you a call and we'll go over everything directly. Daniel, also, if you want to go ahead and take care of that, you can always call our customer service line. But thank you so much, everybody, for your time, and I hope you enjoy this beautiful day. The sun is shining, and the weekend is upon us. Have a wonderful day, and thank you so much for choosing AAA.